As part of our continued response to the pandemic globally, WHO continues to work aggressively on research and development. As you know, more than 2 months ago, we initiated the Solidarity Trial to evaluate the safety and efficacy of 4 drugs and drug combinations against COVID-19. Over 400 hospitals in 35 countries are actively recruiting patients, and nearly 3,500 patients have been enrolled from 17 countries. On Friday, The Lancet, as you know, published an observational study on hydroxychloroquine and chloroquine and its effects on COVID-19 patients that have been hospitalized. The authors reported that among patients receiving the drug, when used alone or with a macrolide, they estimated a higher mortality rate. The executive group of the Solidarity Trial, representing 10 of the participating countries, met on Saturday and has agreed to review a comprehensive analysis and critical appraisal of all evidence available globally. The review will consider data collected so far in the Solidarity Trial and, in particular, robust randomized available data to adequately evaluate the potential benefits and harms from this drug. The executive group has implemented a temporary pause of the hydroxychloroquine arm within the Solidarity Trial, while the safety data is reviewed by the Data Safety Monitoring Board. The other arms of the trial are continuing. This concern relates to the use of hydroxychloroquine and chloroquine in COVID-19.
Right now, we're not in a second wave. We're right in the middle of the first wave globally, and if we look at the data from South America, as was spoken about, for Africa, for South Asia, and for many other countries, we're still very much in a phase where the disease is actually on the way up. We congratulate countries like Spain who've managed to contain and suppress the disease transmission. But as we've seen in the seroprevalence studies, and Maria may wish to speak to this, the actual number of people who've been infected in each country remains relatively low. So it's when we speak about a second wave, classically, what we often mean is that there will be a first wave, the disease by itself effectively goes to a very low level and then occurs a number of months later. What we're concerned about, and that may be a reality for many countries in a number of months' time, but we need to be also cognizant of the fact that the disease can jump up at any time. We cannot make assumptions that just because the disease is on the way down now, that it's going to keep going down, and then we're going to get a number of months to get ready for a second wave. We may get a second peak in this wave. This happened during pandemics in the past. It certainly happened in the pandemic of 1919 and the Spanish flu. We got a second peak, not necessarily a second wave. And therefore, I think right now, countries in Europe, countries in North America, many other countries around the world, in Southeast Asia, have to continue to put in place the public health and social measures, the surveillance measures, the public health measures, the testing measures, and a comprehensive strategy to ensure that we continue on a downward trajectory and that we don't have an immediate second peak. We will then have to look later in the year whether or not there's a possibility of a second wave of infections coming, and that's particularly of concern when we look at the possibility of having a second wave of infections that may be also associated with with influenza season, which will greatly complicate things for disease control.